Hi, my name is Maili Barahona and I'm going to talk about newborn reflexes. Reflexes are involuntary movement or actions. It's a response to a stimulus and that occurs without conscious thought. Babies are born with a unique set of reflexes that can tell a physician about their health and development. Within the first minute after birth, nurses and doctors assess these reflexes. Some reflexes from infancy last into adulthood. That's how we have two types of reflexes. Those reflexes that are unique to infants and they typically grow out with these reflexes within a few months of birth, and those that are going to be always. Several of these reflexes may be noted immediately after birth. If an adult experiences a brain injury, they might exhibit infant reflexes once more. Examples of injuries that cause these symptoms include brain damage and stroke. Breathing reflex. The first action that the newborn must fulfill at the moment of birth is to breathe. Through the first breath, air enters the lungs and expands them, activating autonomous breathing. Motor reflex. If the baby's head is not supported, the arms will extend outward and then appear to be hanging as the fingers curled. This reflex disappears at approximately 2 months of age. The motor reflex is observed completely in newborn babies who are born after the third or fourth week of pregnancy. Its absence or persistence might indicate neurological defects or alterations of nervous system. Babinski reflex. When the baby's foot is struck from heel toward the tooth, the big toe should lift up while the others fan out. Absence of reflex might suggest immaturity of the spinal cord, and the Babinski reflex might be present up to 1 year. After that, the striking should elicit a downward curling of the tooth. A stepping reflex. If a baby's feet are placed on a flat surface while the upper body is supported, the baby will walk by placing one foot in front of the other. This isn't really walking and will disappear by about 4 months of age. A stepping reflex. In a baby, it's supposed to be innate. However, there might be not stepping reflex in some babies. The total absence of the stepping reflex, as well as its continuance after 4 months of age in babies, could be due to a number of reasons like motor nerve injury and severe neurological deficit during birth. It is also normal for some children, like preterm babies, to have this reflex only after 6 weeks of age instead of having it 2 or 3 days after birth. Swimming reflex. If babies are placed in water, they will move their arms and legs while holding their breath. This reflex will disappear around the 6th month. If it does not appear, it might be an indicator of future problems in the motor system. Grasp reflex. When the palm is touched and the fingers will curl around and cling to a finger or object. This is the reflex that allows the baby to hold hands until it disappears at about 6 months. If it stays more than the usual, it is likely that there is some deficiency in the nervous system.